Patient 25, ma'am. Yes, ma'am. Patient 25, ma'am, no? Sige, ma'am, proceed tayo sa room number 15.
Okay, ma'am.
So, good morning, ma'am. I am your tech for this morning. I am Zyril Marie Arsenbrano. Ma'am, mag-ask lang ako, ma'am, if makaintindi po kayo ng Tagalog or ano pong naiintindihan niyo na dialect, ma'am?
Pwede Bisaya.
Bisaya. O, sige po, ma'am. Mag-Bisaya tayo, ma'am, no? Ano pong pangalan natin, ma'am?
Nikki Reyes.
Sige, Nikki Reyes. Para i-double check lang natin, ma'am, ha, yung information mo. Para sure po tayo. Nikki Reyes po. Age po, ma'am?
22 years old.
22 years old. Birthday po, ma'am?
March 2, 1999.
March 2, 1999. Correct. Ma'am, ask lang ako, kanusta po imuhang last na menstruation, ma'am?
Last week pa?
Last week pa. Wala man ka na x-ray this year, ma'am, no?
Wala man.
Wala kay other na x-ray examination? Okay, so wala, ma'am. Ma'am, pwede ko mangayo sa x-ray request ni Doc?
Ay, kani ba to, ma'am?
Ay, oo, kani. Sige po, kani. Asa di ang sakit sa imuha, ma'am?
Kanang diri man dapit.
Diha. Ngano na, unsa di ay ka, ma'am?
Kanang na-slide ko, tapos kani manggod, nagdiretso tukod ba?
Natukod ni mo, ma'am. Sige. Sakit man na, ma'am, no? Dili kayo ni mo mal. Ayaw lang kayo liyo ka, ma'am, para mahumanta, ma'am, no? Kani, ma'am, instruct ka, mag-change ka og patient gown, natay fitting room dito, tapos tanggalin na to atong jewelries and any metallic objects, ma'am, ha? Kaya parang maka-start na to sa atong procedure.
Sige, ma'am.
Ay,
Man ako, ma'am.
Ay, sige, ma'am. Dali, proceed ta, dali, ma'am.
Sige, ma'am.
Sige, ma'am. Diha lang, tindog lang ta diha, ma'am. Magtindog lang ato ang patient. So, ma'am, mabutang taog gonadal, ma'am, ha? So, we put the gonadal shielding for the patient to be safe during the procedure. So, in our AP projection of the scapula, you have to ask the patient to be in the erect position or supine positions, but the erect position may be more comfortable for the patient. So, mas dili maglisod ang patient if you will allow him to stand or in an erect position. So, the posterior surface of the shoulder is in direct contact with the IR. Then, make sure that there will be no rotation toward the affected side. So, in this patient, we have the right scapula, which is the affected side. So, ma'am, mugunit ko, ma'am, ha? Ana lang ka, ma'am. Susandig lang ta diha. Because there will be a greater superimposition within the rib cage. So, in a part position, position the patient so that the mid-scapula area is centered to the CR. So, mid-scapula is here. The mid-scapula is here. Then, it is centered to the CR. So, you can adjust the image receptor, which we will be using an IR size of 10 by 12. So, assuming that this is 10 by 12, it has a 10 by 12 cassette. Then, you have to adjust the cassette and center the CR at the top of the IR. It should be about 2 inches above the shoulder. So, 2 inches above the shoulder from the lateral margin of the rib cage. So, gently abduct the arm 90 degrees and supinate the hand. So, ma'am, ihugunit ko, ma'am, ha. So, itaas na to atong kamot. Tapos, ibutang nimo sa imuhang head. Ana, ma'am. So, ana lang ka, ma'am, ha. Then, kana, isupinate. Then, abduction. This position will move the scapula laterally to clear more of the thoracic structure. So, para mas dili siya mag-superimpose sa rib cage. Then, make sure that the shoulder, the posterior surface of the shoulder is in direct contact with the table top or the IR. So, for the collimation, you have to collimate on the four sides to the area of the scapula. So, this, assuming that there is a proper collimation, then the CR should be perpendicular to the mid-scapula, which is 2 inches inferior to the coracoid process. So, you can palpate here the coracoid process. So, 2 inches inferior. Then, above the shoulder, and the lateral border of the IR should be about 2 inches from lateral margin of the rib cage. So, appeal the rate 2 inches, then 2 inches po sa above the IR. Then, the minimum SID should be 40 inches. So, kana, you can see, we collimate it on the mid-scapula, the central ring. Then, ask the patient to suspend respiration or to control or to not make any unnecessary movement during the examination. So, get to put the marker on the area of the interest. So, yan na siya. Make sure that you put it laterally or any position na maka-appeal siya sa light field. So, ma'am, I hope, ma'am, ha. Mag-shoot na ko in 3, 2, 1.
So for the anatomy demonstrated in the AP of the scapula, we have here, as you can see, the acromion is visible along with the clavicle. Here, this is the clavicle. We have here the coracoid process. Here, then the glenoid cavity, which is the attachment of the humeral head. And we have here the lateral border of the scapula. We have also here the ribs. It is also visible. Then this is the medial border of the scapula. Then the inferior angle of the scapula. Kani, na siya diri. Then there is an evidence of proper collimation because the humeral head was included along with the clavicle and the scapula, which is the main anatomy of interest. The lateral portion of the scapula is free of superimposition from the ribs. So this is the lateral portion of the scapula and there is no superimposition with the ribs. Then the scapula is horizontal and not slanted. So, kana makita man nimo siya na horizontal siya, tas dila siya nakaslant. The detail of the superimposed lung and ribs is also visible. So, kani makita ang superimposition niya sa medial side or medial border of the scapula. Mag-superimpose sa ribs. Then, acromion and inferior angle. Kani, acromion and inferior angle is also visible. Then, the soft tissues and the bony trabecular detail are also visible.
Next, we have the lateral projection. Then, now, the affected area of the patient is the left scapula. So, ma'am, then have the patient reach across the front of the chest and grasp opposite shoulder. It will demonstrate the body of the scapula well. So, ma'am, mag-position ko, ma'am, ha. So, ana, i-oblique ang lawas sa patient. Ana. So rotate the patient in a 45-degree. Then have the patient drop the affected arm. Then flex the elbow. Then place it behind the lower back. So, ma'am, lang mo, ma'am, ha? Comfortable ba ka, ma'am?
Oh.
Then, just let the arm just let the arm hang down. This best demonstrates the acromion and the coracoid process. You can palpate the borders of the scapula and rotate the patient until the scapula is in a true lateral position. So, 30 to 45 degrees from the lateral position. Then, this position of the humerus will demonstrate, this position of the scapula will demonstrate the lateral projection of the scapula. So, align the patient to center in the mid-vertebral border to CR and to the IR. So, So, mapalpate ni mo ang coracoid process. Then, diri mag-enter ang central ray. For the collimation, so, collimate on the four sides of the anatomy. Then, the central ray will be at the mid-vertebral border of the scapula. So, diri, assuming that you can palpate here, then the minimum SID will be 40 inches. Do not forget to put the marker at the lateral side of the anatomy, which will be included in the light field also. So, na siya. So, ma'am, instruct the patient to suspend respiration during exposure, ma'am. Ay lang talihok, ma'am, ha? In 3, 2, 1, shoot.
Lateral scapula. The radiograph of the scapula. This is also known as the scapula. Why? Because the appearance of the scapula here is more shagway kani. Diba? More shagway. Then, ang structure shown here we have is the placement of the arm, which will be based on the placement of the arm, which will determine the portion of the superior scapula that is superimposed over the humerus. So, what part of the scapula will superimpose the humerus, which is, this is ang humerus, then this is the superimposition of the scapula. So, there is an evidence of proper collimation, yes, because we have here the proximal humerus along with the lateral view of the scapula and a little bit of the rib bones. Then we have the lateral and medial border superimposition kani. So makita nimo ang lateral and medial superimposition kay dili na siya kaayo maklarod, pero ang inferior angle of scapula stays the same. Makita lang gyapon nimo siya kay naaman siya sa baba dapit. Then there is no superimposition of the scapular body of the ribs. So wala nag-superimpose, dili same sa AP ganiha nga na superimposition sa medial side of the scapula kani kay dili siya nag-superimpose. Then there is also no superimposition of the humerus in the area of interest. So wala po siya superimposition sa humerus. Then the lateral thickness of scapula with proper brightness. So kani na eye thickness, makita nimo na eye thickness sa scapula, which maklaro gyapon siya nga scapula siya. Then naa siya a little bit brighter siya kumpara sa laing bones, since mauman siya ang ato ang anatomy of interest. Then the inclusion of the acromion and inferior angle. So this is the acromion process and the inferior angle kani of the clavicle. Then we have the soft tissue also, kaning mga puti-puti diri, and there is a trabecular details.
Sir, tapos na po tayo sa procedure natin ngayon. So, pwede ka na po magbihis doon, sir, sa bisanan natin, sir, para balik ka dito sa akin, tapos instructionan kita regarding sa result mo, sir, ha? Na?
Yan na go.
Oh. So, sir, tapos na tayo na, sir. Salamat ka. Salamat po. Tapos, sir, balik ka dito after 2 to 3 hours po para kunin yung result mo, sir. Tapos, pakita mo lang yung resibo mo, sir. Opo. Salamat, sir. Sige po, ingat po.